My name is Ipileng Mohlala, CEO of Early Care Foundation. We are currently partners of the DBSA, the Development Bank of Southern Africa. We are piloting an infrastructure project with ECD centers where we want to find out what is the investment that is needed in ECD to ensure that ECD centers are compliant with the regulations and the requirements of the Department of Basic Education in order for them to reach gold status.
I got a call from Early Care Foundation in Infrastructure. Kile is believe, kile gaba happy, but we are coming to assess your ECD. Baile bata, le his team ke Livwani. Bafita ba monitara, kile gaba happy. I cried. Ibele silo salitabo. Uri krechiaga ile uchencha.
My name is Lunga Skuman, Program Manager for Social Investments at the DBSA. The DBSA believes in the vision of building Africa's prosperity, and Africa's prosperity begins with children, and therefore we've got a dedicated focus in early childhood development, and we work with a range of partners to provide a comprehensive support to ECDs. And one of that particular forms of support is infrastructure support. It's very close to our business, but also very critical for the ECD sector.
Improvile ke ahile forum ebe ke thusa ke batho ba Early Care Foundation hore ke renovate moaho wa ka hona ho pala ke be ke palla ko ho penta le ho lokela ceiling
Ban renovatile my ECD is beautiful. I have an office. I love children. I love to play with them. I love to take care of them.
Before the Early Care Foundation come to our ECDs, it was a mess. It was only one room and a toilet and a dirty kitchen. Let me say this. So now we do have 2 classrooms that the Early Care Foundation have built for us, and the painting, also the ceiling, also the roofing.
We work with the Early Care Foundation on a number of interventions, including the training of practitioners on a number of aspects, including governance, financial management, and the likes, to ensure that these ECDs are also operating within the correct governance as well as operational standards. And so we are quite proud of the partnership that we have with this particular organization and many others as well that we work with in delivering quality and conducive learning environments for children in our country.
Our role as environmental health practitioners in the early childhood development centers is to ensure that we play a very, very critical role to ultimately ensure that the centers, they reach the certain level of compliance. We ensure the health and safety of the learners and the staff occupying those centers. And we reached that through the environmental health inspections that we do. We assess the environment as a whole, the sanitation, the waste management, food safety. We also do the health educations, the awareness programs, and we also enforce the bylaws.
Alongside this, we've been piloting in 9 provinces with 20 ECD centers. And the main goal here is to ensure that, number one, the ECD centers comply with the health and safety requirements in terms of infrastructure, and also to help them unlock opportunities of getting from bronze, silver to gold registration requirements.
We are struggling every day to make sure our centers in Bojanala to register, and it's a struggle. It's a struggle because we end up having poor centers running without, quality education and quality environment. We are standing at 360 centers that they are registered right now on bronze, but they are not funded. But when they are compliant in terms of the bylaws, we need to have a stakeholder somewhere to come and assist. Now, here we are today, we've got Early Care Foundation, which would help us make the crèche behind me to register on bronze and immediately register on silver and ultimately register on gold. So we are happy to say Dipetlona, in a week's time, it will be registered on silver. And on that note, come 2026, 2027, Dipetlana definitely will be funded by the Department of Education. We're going to make sure that it's on the road, it's on the pipeline to register so that it can be able to provide quality education, quality nutrition to our children, to our poor children, and to our stakeholders, especially our local health inspectors. Let's continue collaborating and doing good to our villages.
Through the assistance of Early Care Foundation, now the center is at a stage where we as environmental health practitioners can now recommend that the center be registered. So the registration process is through the recommendations from our reports, where we will be recommending to them that now the center is at a stage where we are confident they can be registered and ultimately receive funding.
The Department of Education has previously implemented the Vangasali registration model. This introduced conditional registration for ECD centers where there was bronze, silver, and gold registration. This enables ECD centers to register at different levels, even though they don't meet all the requirements that are needed. With the current eCares platform, where ECD centers register online with the support of non-profit organizations across the country, the ECD centers can register on the eCares platform, participating on the mass registration drive introduced by the Department of Basic Education. The bronze, silver, and gold levels enable the ECD centers to, one, be recognized on the system, number two, access grants at different levels, ultimately with the goal of registering at gold level, which is where we want to see most of our ECD centers registering.
No, ke mo tseleng ya ho ira certificate sa silver. Ke pasitse sa bronze. Ke krile bronze certificate from the social worker.
Early Care Foundation is quite excited about this pilot. I think on this journey we have learned a lot as an organization. We are still in the process of finalizing the pilot, and we've learned a lot. And we've seen how impactful this project can be for ECD centers. One, in terms of the investment of infrastructure. It's something that most ECD centers battle with because it's quite expensive, and also facilitating for environmental health practitioners and the Department of Basic Education social workers to come into the ECD centers and inspect.
This approach we've taken to ECD infrastructure that has multiple partners who are involved, that is led by evidence of what health practitioners are sharing with us. We believe it's an approach that can be scaled. It's an opportunity for many other people to join us on this particular journey, other partners, other donors. And so we strongly believe that we've started a movement in a direction that many people can both learn from, but also benefit from the approach and the learnings that we've taken in this journey.
Ka Early Care Foundation ra khona go nna mo go tshwanetseng ba health inspector le di social workers ha batla mo go rona ba kraile gore ke mo go tshwanetseng gore re ka bya bana mo teng.
Ke sa le ba le go leboga thata Early Care Foundation. Ke eme mo ka lebaka la bona health inspector le di-social workers le early care foundation. He nkebe se bona nkebe ke sena moago ona o pentilweng o neng le ceiling. No ke happy le bana ba ka ba happy he pula ena ba no makala ka marothoro di kontle a ba utlwihela ka lebo.
Ke lebohe di-social workers, ke lebohe health inspectors, ke lebohe boholo thata le early care foundation ba ileng ba tlo re ntsha mo matlemeng a re neng re le mo ona. Ka jeno re batho ka health inspectors, social workers le early care foundation re beile bana ba rona mo go tshwanetseng health ya bone. Ke a leboga.
This is a great initiative from the department to ensure that each and every ECD centers across the country is known in terms of where they are, what their implementation strategies are, registration requirements are, as well as where children in South Africa are. So we are very pleased as an organization to be involved in such a program with the Department of Basic Education, as well as with DBSA in terms of helping unlock opportunities through infrastructure support. We also recognize that there is a lot of support that is needed in early childhood development. It's not just infrastructure, it's also the quality of our early learning programs in ECD centers, with day mothers, in toy libraries, and all ECD services across the board. And we want to ensure that the ECD centers are supported with multiple platforms that are available to them.